Fear of change will never make you see better opportunities. However, there's always a tendency to feel very secure in the pond where you find yourself now. But I want to tell you this morning that if you do not make an attempt to venture out of that pond, you might never know that there is something called an ocean. Holding on to something that is very good for you now may be the reason you have not seen something better. There's always something better than where you are now. On the note of seeing something better, because this morning we're going to be giving you a better deal, I welcome everyone to the longest running television magazine show, coming from you live from NTA to Victoria Island, Lagos. The show remains morning right, with the estimated population in Nigeria of over 200 million people, and records shows that we have only about 81 clinical oncologists in Nigeria. Unfortunately, it is recorded that on a yearly basis, Nigeria records about 200 new cases of cancer in the country. The most common cases in Nigeria in men are, we have been told, is prostate cancer, and in women, female cervical cancer. Today in the studio we have an oncologist, yes, in the person of Dr. Omolola Salako. She is the founder of Shebekli Cancer. Good morning.
Good morning.
Good to have you on the show.
It's a pleasure.
Unfortunately, all over the world, it's a deadly disease, and it's almost people do not really know how to manage it. And from what I read, most of the times that late discovery usually leads to death. We are talking particularly about cervical cancer this morning. Tell us, how, as a lady, as a woman, how do you begin to know that there could be symptoms of cervical cancer in your system?
Okay, so thank you again for the question. Cervical cancer, to start with, what is the cervix? The cervix is the neck of the womb. That's the part where when a woman is delivering a baby, the doctor says, or the doctor or nurse says, oh, the neck of the womb is expanding to allow the baby out. So that neck of the womb is where cancer arises, and when that happens, it's called cervical cancer. What causes it is a virus called human papilloma virus. I'll call it HPV for short. Now, when people engage in sex, whether it's anal, oral, or vaginal to penile sex, HPV is transmitted most times. Luckily, a lot of women are able to clear that HPV virus. But when it persists on the neck of the womb, it then begins to cause a rash, which can take from 10 to 15 years to become cervical cancer. So for example, a young lady or young woman has sex at maybe 25, 30 years old. She gets the virus. Her immune system does not clear it. That virus will stay on the cervix, causing chronic infection, and that can go until she's age 40, 45, and then the first few symptoms of cancer begin to show. The symptoms of cervical cancer, number one, is abnormal vaginal bleeding. So we know there's normal and there's abnormal. Normal is when a lady is menstruating once a month, a lady is bleeding after she delivers. Abnormal vaginal bleeding is one, bleeding after sex, that's abnormal. Two, bleeding in between periods. And three, bleeding after menopause. Menopause is when a woman has stopped menstruating in her 50s or 60s, and all of a sudden she sees her period again, or she starts to bleed. So that's really the first and most common symptom in cervical cancer, abnormal vaginal bleeding. But I must state that there are other conditions in women that cause abnormal vaginal bleeding, like fibroids. Certain infections can cause abnormal vaginal bleeding. So if a woman notices bleeding that is abnormal, you should see your doctor.
That's a major
cancer is a very nasty disease. It's very troublesome. It's one of the diseases that science is struggling to provide more answers and more treatment that can cure. But the limited information we have right now tells us that there are certain cancers that we can prevent, like cervical cancer. There are certain cancers that we cannot prevent, but we can reduce the risk, like breast cancer, prostate cancer, colon cancer. There are certain cancers that we can treat effectively and cure. Lymphomas, some children cancers, some breast cancers, cervical cancers, even colon cancers if we detect it early. But it is usually terminal when patients present with stage 4. When there was stage 1, stage 2. When it's approaching stage 3, stage 4, it becomes very difficult to say you can cure or control the disease. So we use those scary words, not in the clinic with the patient, because we are all human beings. You can communicate that we cannot treat this or we cannot cure this disease, but we won't use words like life-threatening. Cancer is or terminal. It's already, there are simpler ways.
The word cancer alone is enough to destabilize
yes.
everybody. Okay, you talked about prevention. You talked about, I will still go back to cervical cancer because I'm a lady, and that's my
and I agree with you.
And when you were talking initially, you said something about HPV is transmitted some 15 years, could be transmitted some 15 years before we have seen it. So you said that during intercourse that is being transmitted. Is that a normal thing? Is it something that is being transmitted normally? Is that a normal occurrence during intercourse? That's my first question. Then how can this cervical cancer be prevented?
Okay, so the first question, about 60% of people who engage in sex have the infection. It's transmitted. It's a common infection that doesn't cause much symptoms, and most times it's cleared.
Oh.
Most times it's cleared. The woman does not even know she has HPV infection. It's only a small percentage that the virus stays on the cervix for a long time, as long as 10 to 15 years.
So how can that be prevented?
Very good question. Now, if that virus if it stays for 10 to 15 years, it begins to cause a rash. And that is the rash we are looking for when we are screening. Pap smear, visual inspection with acetic acid. We are looking for that virus. We are looking for what the virus causes that rash. If we pick it up, that is stage 0. Pre-cancer, it is not yet cancer. And we can treat it effectively and prevent full-blown cancer. In terms of cost, it's less than 15,000 naira to do a pap smear. There are other cheaper tests, 3,000 naira. There are many community outreaches today where it's even free. If we detect that rash stage, we can treat it effectively, less than 100,000 naira. But unfortunately, every year, at least 14,000 women go through that rash stage, develop stage 1 cervical cancer, stage 2, then they come to the hospital to see the clinical oncologist or the gynae oncologist at stage 3 and stage 4, where they will spend close to 2 million naira to get treated, and there's no cure. Because to cure cervical cancer, we need certain facilities, surgery, radiotherapy, which is not really available in the country. You need to treat a patient within 8 weeks to get the best of care. But a patient has to take radiotherapy, let's say in the north, and then come to the south for brachytherapy. Wow. And that takes 3 months. So it's almost impossible to cure these cases because there are so many factors: availability of the machines, the waiting time, which can take 2 months, the cost. Many patients walk into the hospital quite all right, and they walk out because they can't afford it.
The HPV, does it mean that it is the man that transmits it into the woman?
Okay. Very intelligent questions. Okay. So the human papilloma virus causes cancers according to its route of transmission. Okay. The most common is a man and woman, vaginal and penile sex.
That's right.
In women, this HPV is known to cause 99% of cervical cancer. It also causes other reproductive cancers like vulvar cancer, the skin around the vagina. For men, it actually causes penile cancer, penis cancer.
Well, I'm just hearing this for the first time.
The same virus.
So who transmits it to who?
The man can transmit to the woman.
It can be both ways.
So this virus occurs in the process of the intercourse.
Yes, and stays there, and it can clear or it just stays there. In gay men who have anal sex, they are at risk of anal cancers.
Okay.
For people who have oral sex, they are at risk of head and neck cancers, and this is scientifically proven when you check
head and neck cancer?
Oral cancers, tongue cancers, head and neck. So it's one of the viruses that is strongly tied to starting the cancer process, which we call carcinogenesis. Same thing with HIV. When someone is HIV positive, the immune system is reduced and it creates room for cancer to grow. So it is very common in women who are HIV positive. It is a risk factor that they can develop cervical cancer at a very younger age, in their 30s. So if someone is HIV positive, it's important they use their medications, they do their pap smear and all their cervical screening. Now, to your first question, which is the sexual habits, we promote the ABCs of sex. Abstain if you do not have a married partner or one partner. If you really have to engage in sex before real commitment, whether it's marriage or whatever arrangement, B means be faithful to that partner, to that one partner. And if you must move around, then please use a condom. It reduces the spread and transmission rate. Okay. So cervical cancer is really tied to chronic infection with HPV. Okay, so for cervical cancer, abnormal vaginal bleeding, foul-smelling vaginal discharge. Again, women tend to have all types of discharge at different times in their life, but with cervical cancer, the discharge is like a lot, almost we call it copious. It can be a handful, it may be blood, it may be brown, it is very, very smelly, there may be low back pain. For breast cancer, a common symptom is a breast lump, which is usually not painful, or a lump in the armpit or above the collarbone. For prostate cancer, a common symptom is there's a change in urination, like a man is to pee up front, but instead of the pee going straight, it wiggles, or there's waking up at night to pee a lot. I must say that all of these symptoms may be due to cancer or another kind of condition, but it's so important to see a good doctor.
Okay, quickly, because we have to wrap up. Sorry, I have to cut your thought there. Let's go back to what you do, your NGO. Yes, because I won't leave that. And the pap smear, you know, what are you doing for people? Because I understand that you are doing something for your organization, is, you know, helping women to, you know, go about checks and...
Yeah. So for the past 5 years, we've been providing cervical cancer screening in various communities and in certain primary health care centers. And we provide the visual inspection acetic acid test, which is a cervical screening method, to women in underserved communities. Our goal is there are certain women who will not be screened in their lifetime, and we take the screening into such communities. So if you would like to learn more, please, you can visit our website page on shebeklicancecare.org for that. And we do support the treatment of cancer patients in Lagos State here. Okay. You can give us a call. Again, if you visit our Instagram page or website, please give us a call or fill the information, your information.
Okay, that's the phone number on the screen. If you would like to talk to them, if you want to make more inquiries, the phone number is there on the screen for you to call. And did you talk about free cervical test?
Yes.
I wanted you to mention that.
Okay, luckily we are funded by certain partners who provide, who enable us to provide free cervical screening. And if you're interested, please call that number.
The number on the screen.
Go on the website.
You see, the fear of many women or people in this part of the world is the fear of the unknown, or the fear of, they will tell me I have cancer. Can you just give something, some encouraging words to people? You know, when people are so scared of, you know, going to, you know, make discovery of what is happening in their body, just encourage somebody out there before we let you go.
So, dearest women, please come out. It's a 2-minute procedure. It's simple, it's not painful. It's important to know the health of your cervix and that you are not developing cancer, which many women are at risk for. For men, please engage in healthy lifestyle. You also should do your screening. Once you're age 40, you should do your prostate screening. You take your blood sample, go for your medical checkup, eat healthy, reduce your exposure to the sun, reduce tobacco, reduce alcohol. These are some of the risk factors for developing cancer. And if you know anyone with cancer, please support.
We talked so much about cancer and cervical cancer today. It is health that is the real wealth, not the pieces of silver or gold. However, good health is the real wealth. Keep in touch with us when we come your way, same time, same station next week. I remain Yinka Kenny. Bye-bye and God bless you.